Hi, I'm Dr. Christine Anderson. I am a chiropractor and I specialize in pediatrics and pregnancy. And I also have a specialty, a certificate in childhood developmental disorders, which revolves around using things like functional neurology and integrative care to help children with issues, whether it be behavioral or academic, having to do with their neurologic systems. And because it is April and this is a month where there is a lot of autism awareness, I wanted to talk about Autism Spectrum Disorder, or ASD. And this is going to be a four-part series for the month of April. And today I'm going to start off with what is autism and ASD? How prevalent is it? And what are the causes? What is this really all about? So like I said, this is part one of a four-part series. And this has really been a journey for me in my practice of over 30 years. So I have the perspective of coming into this when really the autism issues and spectrum really started to become very, very prevalent. We're going to see that in a minute. So I want to just dive right in and talk about what is autistic spectrum disorder. Well, this autism actually was identified in 1943 by a psychiatrist, Dr. Leo Kanner, and he called it autism because of the word Greek auto means self. And at the same time, very soon after, in Germany, in Austria, but a German-born psychiatrist, Hans Asperger, MD, also noticed particular behavior in boys. And so what they were seeing in 1943, Dr. Leo Kanner noticed a 5-year-old boy, and these are sort of quote marks, no apparent affection when petted, does not observe the fact that anyone comes and goes, never seems glad to see father, mother, or a playmate, and have come into the world with an innate inability to form the usual biologically provided contact with people. So this is what he was observing, and when we're looking at children, even adults, but I'm seeing children with the autistic spectrum disorder diagnoses, these are a lot of things that we can see. And then Dr. Asperger was noticing that a group of young boys in Vienna had a lack of empathy, clumsiness, intense absorption and special interest, and inability to form friendships. So again, these are symptoms or traits that we see children with Asperger's and autism and even possibly pervasive developmental disorder, not otherwise specified. And this is the umbrella term autistic spectrum disorder that covers all of these. And that's a term that has only been used since 1987. So when I'm saying autism, a lot of times I'm meaning ASD. I'm using them interconnectedly, but we'll talk about the difference between Asperger's as far as the severity of autism, because with Asperger's, you are having a child who has a milder form, so-called, of autism. And then pervasive developmental disorder, not otherwise specified, it just didn't fall into each category. And so they just kind of put it into this ASD syndrome spectrum type of thing. So what we're doing with this diagnosis of autism is really looking at subjective observation of the child, whether it's from the parents, usually they're garnering information from them, teachers if they are going to school, medical physicians, usually a psychiatrist is observing. Sometimes there's some questionnaires that can be filled out, but there are absolutely no medical tests. You cannot image the brain and say, oh, well, because this is occurring, we have autism. So there's nothing organically wrong with the brain. It's really more of a malfunction in the way the brain is functioning or acting. But structurally, there's nothing going on per se. Sometimes they might find little things like a smaller corpus callosum, but nothing pathognomonic of this is autism. So what they did was the American Psychiatric Association created a list of things, a criteria that they put in their Diagnostic and Statistical Manual of Mental Disorders, or DSM for short. And what they said is autism is diagnosed when a child exhibits behavior and certain types of behavior in the areas of communication, social interaction, and repetitive behavior. So that is what they are looking at. So let's take a little bit of a closer look at that with this diagnostic criteria. And you can go and look at this and look it up because there's different categories underneath these. But the first one, A, is persistent deficits in social communication and social interaction across multiple contexts. And then they say, as manifested by the following currently or by history. So deficits in social emotional reciprocity, deficits in nonverbal communication behaviors and social interaction, eye contact, deficits in developing and maintaining and understanding relationships. So imaginative play, making friends, and really being interested in your friends and in your peers. So we'll talk about severity in a bit, but it is based on how much of a deficit there are in these areas. And then with B, we have restricted repetitive patterns of behavior or activities as manifested by at least two of the following examples. And that would be stereotypical or repetitive motor movements, use of objects or speech. So that would be things like lining up toys, flipping objects, something called echolalia, where the child will repeat what you're saying. Insistence on sameness. You cannot change the routine. You cannot change what they are used to, or it really messes things up. They usually get agitated, have anxiety, a tantrum. So they have very rigid rules in what they like to do, and that might be times a day or things that they're doing. Highly restricted fixed interests that are abnormal in intensity or focus. They have a preoccupation or attachment to something, whether it be an object or even like you're watching YouTube videos of toilets flushing or something like that. And I mean, this is what's happening with their brain. They also will often have a hyper or hyporeactive. So they're either oversensitive or undersensitive to their environment, to pain, to temperature, to smells, textures, light, that type of thing. So that's part of what might be going on with B there. With C, symptoms must present early in their developmental period. And this means that they're not, they might fully manifest later, but they have to begin in their early childhood because oftentimes kids will have workarounds and they'll work around whatever their developmental issue is, delay or whatnot, and then you might miss that they're having an issue with it. D, symptoms cause significant impairment in social, occupational, or other important areas of current functioning. E, these disturbances are not better explained by intellectual disability, so an intellectual developmental disorder, or a global developmental delay. And they can occur at the same time, but not exclusive of the other. In other words, a child can have a developmental disability but not be autistic. So this is the criteria And then there's different things specifying whether there's language or not language. And that's where we get into the symptoms of severity on the autistic spectrum. And that's where you do get a spectrum. All children who have autistic tendencies are not behaving the same. So we have different levels. Level 1 is going to be the least severe. This child might need some support. Maybe they need to do some socialization classes or have reminders about how to act and behavior and that type of thing. They might be prodded. They have, to be drawn out to be social. They might have inflexible behavior, but you can work with them so that if you give maybe a longer transition time, they have an easier time. Level 2 is more moderate. They need substantial support. They really need to be moderated in what they're doing. They might be having difficulty with how they're communicating, whether it's being able to speak and speak clearly and coherently and understand what they're saying. Nonverbal communication. They might be doing some repetitive behavior. And then level 3 is very substantial support. You cannot leave this child alone. They cannot care for themselves in any way. They probably are nonverbal, but they can also be verbal with very little ability to speak coherently, little to no social interaction, couldn't care who is in the room. They might have a connection with mom and dad and the people who care for them, but otherwise forget it. And they have an extreme difficulty coping with change. If you take them out of their routine, it is going to just mess everything up. So I want to go into a little bit about the facts and statistics for autistic spectrum disorder. And some of these statistics, I've put the time period on there. So they may have changed. I've tried to get the most recent ones, but things are always changing, but this gives you a good idea. So it's ASD comprises 1% of the world population that has ASD. That's 2014. Prevalence in the US is 1 out of 54 live births. More than 3.5 million Americans have autistic spectrum disorder. Boys are 4 times more likely than girls to have ASD. The prevalence of ASD in the US has increased 119.4% from 2000, where it was 1 in 150, to 2010, where it was 1 in 68, and that was in 2014. So now in 2020, we've gone up to the 1 in 54. So it's on the rise. The prevalence has increased 6 to 15% each year from 2002 to 2010. That's from the CDC. And the cost for it is astronomical. And from 2014, it was quoted $236 to $62 billion annually in the US. So this is something that is really a health crisis in our country and around the world. So let's talk a little bit about this incidence of autism. So in the 1940s, when it was first discovered, it was very rare. 1, maybe 2 out of 10,000. Then in the 1960s, up to about 4 out of 10,000. And so, I also have this perspective too of going to school. I started school in the late 60s and finished up in the early 80s in high school. And you really didn't see a lot of children with developmental issues, at least not in, overt school settings. There was special ed in high school that, it was like one classroom. It was very rare. And you would see the kids around. And actually a good friend of mine, her sister was mentally challenged. So, I was around it, but it was relatively rare. And then when I started my practice, that was in the 1990s. And there you see it's 30 to 60 per 10,000. And again, it was relatively rare. I really was not seeing a lot of kids who had issues with what we're calling now autism or autism spectrum disorder. But things started to shift. I had to think about this around the 2000 period. And so there you see in 2012, it was 1 in 88 incidents of autism. 2016 is 1 out of 54. That's for the 2020 statistics, by the way. You know, by the time they gathered the statistics, years have passed. And when you break it down, that's 185 out of 10,000. So a dramatic increase. And I have seen projected and heard people who are experts in this projecting that between 2025 and 2030, that the incidence of autism, at least in the US, will be 1 out of 2 children. That is projected, but it's projected based on the values that have come before. So if you look at this is the prevalence, and you're seeing there about 2004 and then 2020, there's that 1 in 54. When you exponentially raise something, and if you keep taking that graph further for another 10 years, that's where they are coming up with these values of 1 in 2 children will have autism. So that means you are either going to have autism or you're going to be taking care of somebody with autism. And that is a pretty frightening statistics, frankly. So this is another reason why it is so important to become educated in this, because if we can do things to help prevent autism, then that's going to really make a difference. And I do have some of those, hopefully, solutions here. And then there is a difference by state with autism. And the ones in the light blue have the least incidence, less than 2, or 2%, I should say. And then the dark blue is, I think it's 2 to 2.9. The light green is 3 to 3.9, and the dark green is greater than 4. So there are differences between each state, which is pretty incredible. It would be really amazing if we looked at what is going on in each state with healthcare, with environmental, to see what differences and if we can relate that all to the incidence of autism. All right, so epidemic or better diagnosis of autism. What is it that is creating this rapid increase in incidence? So let's talk about this a little bit, because different people will say different things. And you'll hear a lot, well, you know, they're diagnosing it better, so that's why, or it's genetic, or, you know, you're going to have different people saying, well, this is why. And we have a study actually from 2011 from Yale University, which looked at where did this rise in autism come from? And they found that 25% came from something called diagnostic accretion. And that is children who would have been diagnosed with a condition such as mental retardation or, you know, another disability 10 years ago or so. So that's included now. It's in this ASD. Better diagnosis and awareness, 15% they found. And so, sure, better diagnosis and awareness certainly does make a difference, but 15% worth. Geographic clustering is very interesting. That's where you find higher diagnosis in a region. That leads to more testing, and that leads to more diagnosis. Well, that's 4%. And then they added in 10% for older parents. This is women over 40. It seems to be a risk factor, and they allotted 10% for that. So that comes to 54%. But what is the other 46%? That is the question. And I would beg to challenge anybody to say or to find anything else it is due to. So new cases could be the only other explanation for the additional 46% increase. And when you look at what the explanation, what the definition is of epidemic, that is, the term is affecting or tending to affect a disproportionately large number of individuals within a population, community, or region at the same time. Well, 46% is almost half of our population, and to me, that constitutes an epidemic. So this is something that we really need to take notice of. On top of this, at UC Davis, they found an 800% increase in autism diagnosis from 1990 to 2006, and they too found that not more than about 50% of the increase in cases were due to the things that I just talked about here. So let's venture a little bit further into the causes of autism spectrum disorder. Genetic versus epigenetic. So what does this mean? Well, in general, genetic mutation causing autism is really only found rarely in like 5 to 15% of cases. Now, they did a very interesting study looking at this genetic aspect in 2011 with 192 pairs of twins, and they found that the fraternal twins had a higher rate of autism versus the identical twins. Now, you would think it'd be the opposite, especially if it was genetic, right? So what they actually found was that environmental factors were showing a 60% risk of autism spectrum disorder versus genetic factors, which were 40%. So environmental factors are going to be the things that affect how you are expressing your genes. So our genotype is our genetic profile. That's the actual DNA. That's the genes. But the phenotype is how we express those genes. And that is what we are calling the epigenetic effect. So let's look at this a little bit more as a cause of autism. Epigenetic gene regulation is going to affect the variable expression of our genes. It is dependent on environmental factors. And it is going to, most of the time, your genes are going to be in the off position. So activation of these genes, turning them on or turning them off if they're on, whatever it might be, can occur when certain chemicals or a chemical reaction in the body attaches to the genes. And the most powerful influence on our system when we're developing our sensory stimuli is the biggest: touch, smell, taste, sound, temperature, and gravity. All of these things have a profound effect on how we develop. And that even starts inside in the womb. Okay, when you are in the uterus, you are still touching, smelling, tasting, sound, temperature. You're floating. You've got a little bit of gravity, though. You've got the pressure of the amniotic fluid. But all of those things start then and continue when you come out. Now, gene expression can also be affected by the toxic chemicals in our environment, stress, our diet, social interactions, and this can start again in utero with whatever is going on with mom. So this is really especially crucial for a developing fetus and for young developing children, especially in those first 3 years of life or so. That's so critical for brain development, because if it doesn't start off on the right foot, you're going to have to do some workarounds in the brain. And sometimes the brain isn't able to handle that so well. So this is why I love to work with women, especially who know they want to have a baby. I like to start working with them a couple of years in advance so that they have time to clear out any toxins that might be stored in their body, help mediate their stress, work on their diet, and maybe even change what they're doing in their life so that they stop exposure to chemicals, because we don't know for sure exactly the thing that causes autism. So the better you can make the situation, the more things you can do, the better. All right, so epigenetic gene regulation. I hope you're still with me on this one. I just want to talk a little bit more about this because it has to do with this DNA methylation. And this methylation process is what controls the gene expression, all right? It's going to turn those genes on and off. That's really kind of the key. So in other words, this is why you can have two parents who don't have autism have a kid who has autism. Because if you don't have that gene turned on, and then you have your child and something occurs in their environment to turn it on, then they can have autism. It also could be that something turns on in the parent or one of them, and then that gets transferred down the line in the genetic lineage, because these DNA methylation products tend to stay attached to the DNA throughout the life of the cell and then transmits to all the cells in the lineage. So this is how epigenetic changes can become inherited. Something you're exposed to in your environment in your lifetime can then change what goes on with the expression of your DNA, and then you pass that on to your children. There is also a phenomena with parents with an autistic phenotype, and it's often the more subtle things that a child with full-blown autistic tendencies has. So maybe a parent who's not so social, or they're a computer geek, Silicon Valley type A workaholic. There is something to be said. There is a phenotype, so an expression that a parent might have, and they possibly could pass this on to their children. So let's talk a little bit more about these other potential environmental causes, and this goes more to the toxins that you might become exposed to as a baby, or when, a fetus, or when you come out as a baby. And that includes things like pesticides and herbicides, including glyphosate. And this does interfere with the genes involved in the central nervous system development. How about genetically modified organisms? So, we saw this, this really big increase starting in the 1990s. And, I really should go back and figure out when GMOs, when they told us they were being introduced, because I can't really remember. But I'm just, you wonder, are these things having an effect cumulatively because so many of these things are going on? Prenatal pharmaceuticals. Now, we still are using them. There still are things that women take when they're pregnant. It is less. I'm hoping they do studies on them, but sometimes you have to ask, you have to wonder, have they actually studied things they're using in pregnancy for pregnant women? Household and body care cleaners, body care products, all these type of things do have chemicals in them that can disrupt hormones. They are carcinogenic. There's so many things that goes on, and I'll put a link to the environmental working group in the description where you can look up your products and see how toxic they are, including for reproduction. EMFs. So, I know this hasn't been studied. So again, these are potential environmental causes. I don't know exactly what is going on because nobody has a clear answer as to what causes autistic spectrum disorders, but I do know EMFs can disrupt our neurologic systems and also what goes on with the electrolyte balance in the cell and how it functions because it is electrical. So something to consider, EMFs. And then we have vaccines. Now, the CDC will say on their website that they have proven vaccines do not cause autism, and that is actually false. And Del Bigtree of the High Wire has actually been back and forth with them about taking that off their website because they have not proven it. He asked for papers from them. He asked for papers for the vaccines that are given in the first 6 months of life and the studies that have shown that vaccines do not cause autism, and they have not been able to prove this. So he got them to take that off the website, but then it came back on again. So he is working to get them to take that down again. So there is something you do need to know, that there was an act called the 1986 Act, which took away the liability from any vaccine manufacturer if your child is injured from vaccines. So you have a manufacturer who has no culpability for their product, and therefore there is no reason for them to really put an effort to make a safe product. And this is the problem, because after 1986, you started to see, again, an exponential rise in how many vaccines they put out on the market. And you can verify this for yourself. I mean, don't just take my word for it. But I do know this because I started having my children in 1990. And this is about when I started noticing it then, but by the time I had my second in 95, this is when they really started ramping up the schedule for vaccines. Before then, it was very minimal. So this could be a contributing factor, and I'm all about informed consent. We just need to know what is the risk to injecting a possibly toxic product into a child's body. There are so many ways to get that information, and I will put the links in the description, like the National Vaccine Information Center from Barbara Lowe Fisher. Absolutely amazing information for you to start looking at. There's Vaxter.com from Dr. Sherry Tenpenny. She even has a university you can enroll in to learn all about vaccines. And look, we read labels, right? With the food we're eating. We want pure things in our world, and yet with vaccines, how many of you have read an insert? It will tell you right on there what the risks are, what the side effects are. So this is just a broad introduction for those of you who are looking at this and going, how can I possibly prevent my child from having autism? Or if I have a child who's on the spectrum, what are maybe some causes that might have gotten them into this situation in the first place? Because you don't want to keep doing the same things that are creating a problem, right? So that's part of this. All right, let's carry on. Causes of autism spectrum disorder, a neurologic perspective. So I am offering this fresh perspective from a chiropractor who specializes in pediatrics and pregnancy, who is certified in childhood developmental disorders, who has studied functional neurology, and the fact that this is a way of looking at, remember I said there's nothing wrong with the brain. It's not the structural per se, it's the functional. So if we look at what are some of those symptoms that these kids with autism spectrum disorder are portraying, what if those symptoms are due to functional imbalances in the brain and connectivity? So I did a video on functional disconnection syndrome that I will put in the description so you can go back and watch that. Because if the right and left hemispheres of the brain are out of balance, it's going to create an inequality of skills, and that is going to give you the symptomatology of what you see with a child who is on the spectrum. So stay tuned for part 2 next week, and I will be talking about what is going on in the brain of a child with autism spectrum disorder. All right, so that is it for part 1. If you need to reach me, you've got my website here, and I will also put it in the description. And if you want to reach out to me, please do. If you have a child who you think might have autism, give me a shout out, contact me. Or if you know your child has been diagnosed and you want to start working with trying to get their brain in balance, give me a call. You never know. If you're not in my area, there's some ways we can do things remotely, or I can help and try and help and find somebody in your area. All right, have a great week, and I will see you next Tuesday at 6:30 Pacific time. Give me a thumbs up if you found this helpful. Share it with your friends. Please let them have this information, especially if they have children or are thinking about having children. and subscribe and hit that notification bell. All right, bye.